Welcome back to Healthwise with Dr. Kim Dakin and all about ears. Dr. Dakin, before we go any further, I guess you showed us the hearing aid, and they are tiny. I've never actually seen that small. But what else do you offer in your office as far as
and one thing we do is we have a couple different products for swimmers' ear. We have some little ear molds that we make little ear molds in our office that are custom, that will float if they come out of your ears, that are bright neon colors that the kids really like. Some kids don't like putting anything in their ears, so we have these little swim bandits that you put around your ears, like a little headband when you're swimming, to keep your ears dry to prevent swimmer's ear. We also have Bluetooth amplifiers that a lot of people will use in their car. People with hearing loss that have a hearing aid and have problems talking on their cell phones, we have Bluetooth amplifiers. One of the most common demographics are people our age that are having hearing problems, so they like that because they all have their Bluetooth.
You mean people 20 years old?
Yes, 20 years old. And they've been listening to that car music too loud. But we also have tinnitus attenuators. That's that buzz that you hear. Some people can't sleep due to that buzz. So we have little machines that'll mask that noise that'll help you rest. We also have earplugs that we'll custom make for you to protect your hearing, like if you're hunting, that'll allow you to still hear the animals, but they'll shut the noise off when the gun shoots.
They're electronic?
They're like a little hearing aid, but they're not a hearing aid. They'll mute that noise when the explosion goes, so you won't damage your ears. So those are custom made to devices for people who have some hearing loss and they need to protect what they have left.
Okay. You mentioned swimmer's ear. A lot of I guess the audience might not know what swimmer's ear is. Can you tell us a little bit what?
Swimmer's ear is not necessarily from swimming, but it's common we get that from swimming, especially from swimming in some contaminated water, which every water is. But that is an inflammation in your ear canal that becomes infected with bacteria, and it's very painful and very common here in Louisiana. But you'll have tenderness to just touch to move your ear canal can completely swell shut, and that generally needs to be treated with ear drops. But if you let it go to the point where eardrops won't get in, you'll have to actually take an antibiotic for. So it's a very painful and very common in kids who are swimming, but you can get it from taking a shower. Just when water gets trapped in your ear, if it's contaminated, it can cause a swimmer's ear.
Wow, that's good to know too. I'll never swim again. I noticed also you have some skincare products. What are those for?
We do, and in the summertime, while you're going swimming and protecting your ear, we really recommend that you wear sunscreen. And one of the products we have in our office for skincare are the Vivite line, and a day cream does have an SPF 15, and you put that on under your makeup or in the morning. It exfoliates. It's a glycolic acid product. It removes that top layer of dead skin, and then it moisturizes and protects. All of the products have glycolic acid, but different ones have different products. We have a little eye cream that has some caffeine. Different ones have pomegranate oil. They're full of antioxidants to prevent aging in your skin, prevent wrinkling. So we have a whole skincare line that we have in the office, including that sunscreen that we want you to wear in the summertime.
I'm gonna buy some. Okay, Doc, well, tell us a little bit. We've got like 3 minutes left in the program. Can you tell us a little bit about your schooling, and where'd you go to school at, and what made you even decide to be an ENT?
Okay, I always loved math and science, so when I was at LSU undergrad, I majored in biochemistry, and when I started looking at career choices for a biochemist, I became interested in medicine. I started volunteering at the hospital, and I really found something that I loved, and then I moved to LSU in New Orleans, and I went to medical school there, and I did a general surgery internship there, which is required to specialize in ENT, and that's when I started rotating through the different surgical specialties, and ENT was the one that I liked. The ENT is awesome because you can treat a whole family. We see little kids to the grandmas, and you can keep up with all your patients, what's going on even when they're not sick. And you can do something great like restore someone's hearing, ear surgery. You can reconstruct people's hearing bones. But just letting the fluid out of a baby's ear with ear infections is going to help them develop better speech and hearing and really change their life. So ENT helps with that. And then I went to Jackson, Mississippi and did my ENT residency. And when I finished there, I moved back to Opelousas.
Okay. And once again, your office is where? What's the address?
It is 1270 Attakapaw in the Medical Complex North building of Opelousas General Hospital on the second floor on that main campus.
Okay. Well, Doc, like I said, it's been a pleasure having you here, and I learned a lot. I'm sure my audience learned a lot, and we look forward to having you again on the show and talking about ears, maybe even talking about speech. I mean, do y'all do speech therapy or?
The hospital does speech therapy, and we work in concert to come up with a treatment plan for you. So there are different testing that we can do for speech through the speech therapists at Opelousas General, and they'll show us the pictures, and we'll look at the disease process of the vocal cord to see if there's something that needs surgery or needs speech therapy or swallowing therapy, and we'll order what you need to get that taken care of.
Okay, and I assume tonsils too. You know, when we were kids, it was always, man, first thing, look at their tonsils, see if they're inflamed or anything.
We are surgeons, so we will do any of the surgery of your head and neck, from your skin lesions to your sinus lesion to your head and neck cancer surgery to your thyroid gland surgery. So tonsils is one of the main things that we do. We still have to take care of for chronic throat infections or swallowing problems. So that's common practice for ENT.
Well, great. Doc, once again, thanks for having you on Healthwise. And you're welcome to come back anytime. And audience, welcome. And thanks for joining us on Healthwise. See you next week.
Healthwise is brought to you in part by Opelousas General Health System.